Hi, this is Dr. Jason Dulac coming to you from my office, Dulac Dental in Springfield, Virginia. Today, I wanted to answer some common questions we get about fillings. Why would a dentist recommend a filling? Well, if you have a small cavity and it can be easily patched, that would be one indication for a filling. Or if you have a small chip and it can be easily patched. A filling is really a patch for a tooth. You need a majority of tooth structure remaining to do it. So if you get more than half of the tooth or certain parts of the tooth gone, then you need something else like a crown. Are there alternatives to fillings? Sometimes. If it's for sensitivity, there are root desensitizers, or if it's a very, very shallow cavity on the root surface, there's a sealer medicine we can use, works out 4 out of 5 times. I always recommend trying it and, seeing how it looks at your next exam checkup. If it's very, very shallow, sometimes this sealer medication can take care of it. But once it actually gets into the tooth, like a millimeter, you do have to physically remove it and do a filling, or if it's too big for a filling, a crown. What are the pros and cons of different filling materials? In my office, we only do the tooth-colored fillings. We don't do silver fillings anymore. Silver fillings do last for a while, but they expanded when they set. So they made for a tight seal. However, they've also made cracks through the teeth. So a lot of times with a tooth-colored filling, you can fill the tooth multiple times. With a silver filling, after the filling cracks the tooth, it's right to a crown. So at my office currently, we're only doing the tooth-colored or composite fillings. What's the procedure for getting a filling? If you have a cavity or some other reason you need a filling, we get you an appointment at the office, get you numb, do the filling, set it. It's totally set when you leave the office. Eat or drink whatever you want when you leave the office. Just be careful because of the numbing. Fillings are very quick to do. Usually my filling appointments are 30 or 40 minutes. Most of my patients are like, oh, wow, doc, you're done. I'm like, yeah, it's a pretty quick procedure. So fillings don't take long at all, and they're totally set when you leave the office. Is a dental filling painful? The only thing you'll feel in my office for any procedure is the numbing. Were you to choose not to get numb, which I don't recommend, but I have some patients do, it's going to be sensitive once we get into the inner part of the tooth. But I recommend anesthesia for all procedures. And once you're numb, you're not going to feel anything. If we're ever working on you in my office and you feel something, just raise your hand. I'll stop right away. Do fillings permanently fix cavities? It takes the cavity out and it addresses that problem. Other areas of the tooth can get a cavity, or you can get a secondary cavity around the edge. So prevention is important. Fluoride, home care, keeping sugar to meal times, things like that. We do have sedation available at the office. If you want it for filling, you certainly can. We also have laughing gas, Valium, things like that. So we have a lot of comfort aid in the office, pillows, blankets, headphones, noise canceling headphones, stress balls, things like that. But if you want the next step, yes, just let us know. We can do that for any procedure at the office. Does the filling have any side effects? I always say after the procedure, the tooth might be a little sensitive. A lot of times it's not, sometimes it is. If it's a little sensitive, don't worry about it. That'll go away on its own. If the bite's off or anything feels rough after the procedure is done, please give us a call at the office. We'll get that adjusted for you. All the fillings we're placed in the office are tooth colored, so they will match the tooth. They come in a couple different colors, and usually when you're doing a filling, it kind of pulls the light and surrounding color from the tooth, so a lot easier to match than a crown. If you need a filling or think you might need a filling, give us a call at the office. It's Dulac Dental of Springfield, 703-451-4500. I hope this answers some of your questions about fillings, and I look forward to seeing you at the office soon.